Hello everyone, my name is KNUSTWELLNESCENTRE. I'm an advanced midwife specialist from the University Hospital. The month of June is Wellness Month, and Wellness Center, in collaboration with the University Health Services, is organizing health screening for all staff. So as part of this health screening, all female staff are entreated to be screened for cervical cancer. So I'm here to educate you all on cervical cancer. Cervical cancer is cancer of the cervix, and the cervix is the mouth or neck of the uterus or womb. Cervical cancer is a disease of the cervix which can cause death, but can be treated when detected very early. Every year, 500,000 women are diagnosed with cervical cancer, and over half of these women will die. It is primarily caused by persistent infection with high-risk human papillomavirus, which is the most common viral infection of the reproductive tract. Human papillomavirus is sexually transmitted. You can get it through anal, oral, or vaginal sex. Human papillomavirus causes 99.7% of all cervical cancers, and almost all sexually active individuals will be infected with human papillomavirus at some point in their lives, and some may be repeatedly infected. The high-risk types of human papillomavirus can also cause anal cancer, oropharyngeal cancer, which occurs in the throat, vaginal cancer, vulvar cancer, and penile cancer, which affects the penis. The low-risk types of HPV or human papillomavirus causes genital warts. The risk factors for human papillomavirus are having sex with an infected person, also having multiple sexual partners, and also having multiple pregnancies. And these multiple pregnancies are as a result of pregnancy hormones, which causes abnormal cell formation and changes on the cervix through each pregnancy. And also having sex at an early age below 17 years. So the means of acquiring human papillomavirus or HPV is through sexual means and asexual means. So the sexual means is 90% sexually transmitted. Also, having sex with HIV-infected person, having promiscuous male partner, fun of having oral and anal sex, and also being bisexual puts you at risk of getting it. Also, having history of sexually transmitted diseases like gonorrhea, syphilis, and candidiasis also puts you at risk of getting HPV or human papillomavirus. You can also acquire it through asexual means, and these are having low immune system, fun of smoking, prolonged use of oral contraceptives for more than 5 years, fun of inserting the finger in the vagina, which we call douching, and also the use of false panties. And the last one is poverty. Signs and symptoms of cervical cancer are postcoital bleeding, bleeding after sex, unusual bleeding such as in between menses, or bleeding after menopause. Also, vaginal discharge that looks or smells different than usual, and with a very bad smell. So cervical cancer, it doesn't show any signs and symptoms when the condition is starting. You normally don't feel any pain or see anything. You only see these signs and symptoms when the cancer has started. And this cancer, it doesn't start within a day. It starts when you come in contact with this HPV or human papillomavirus. If it stays there for more than 10 to 15 years, it will develop into cancer. So normally the signs and symptoms will appear when only the cancer has appeared on your cervix. So the various tests for screening cervical cancer are VIA, which we call visual inspection with acetic acid, HPV DNA test, and the last one is pap smear. HPV DNA test is the test that we do to know whether you have the virus or not, and if it's negative, you can vaccinate for it. So all female staff are going to be screened for free with visual inspection with acetic acid, which is the VIA. And the screening is taking place at the Cervical and Breast Cancer Screening Center at the University Hospital in the maternity building from Monday to Friday. And the screening will end on 30th June 2023. Thank you.